when we talk about substance use coercion, it doesn't apply to all families.
No.
We recognise that substance use exists on a spectrum.
Absolutely.
Anything from non-problematic, enjoyable substance use to, the other end of the spectrum. But what we're talking about here when it comes to substance use coercion is thinking through how is a person who's using violence exploiting the victim survivor's substance use to extend their own power and control.
Absolutely.
So the example I could think of is, if a woman is choosing to use illicit substances on a night out, then there's no harm to self or others in this context. That's fine. But when she returns home, if a family member is taking that substance use as a way to undermine her, to call her a bad mother, to, use that as evidence to child protection and so on, I think that's really a clear sign to me that substance use coercion is occurring. So the focus here with this concept is really thinking through how's the person who's using violence weaponizing a victim survivor's substance use.
In the family services sector, predominantly it's mums that are referred through, and so they are the primary client with their children. And so how that sort of plays out then is that they are seen as responsible in terms of the parenting role, and when it comes to substance use, and if we don't have a really good understanding of what that substance use looks like, what the real impact is on the children, we go in with a lens of any substance is bad and any substance has a negative impact on parenting and on the children. And so then what that looks like is that we will go in with really high expectations of mum to address her substance use. It's quite harsh, can be quite harsh, and the children are kind of invisible there, even though it's through a lens of we need to protect the children. It really elevates for women, for mums, the concern around risk for their children. There's a lot of, stigma associated with substance use. There's also stigma associated with mental health challenges. And when we think about the expectations on mums as opposed to the expectations on dads, they're quite disproportionate. And so when we have mothers who are experiencing substance use challenges, even including prescription substances, the expectations and the focus, I guess, on them to keep their children safe is so much more pronounced than the expectations on the person using violence. And often that person is using substance use coercion in that relationship.
We often miscalculate the risk. So we focus the risk on what mum's doing because we haven't heard her or assessed her with genuine care, curiosity or capability. And so, as Monique was saying, we are meeting her with a moral view and kind of the moral paradigm of substance use rather than exploring what does substance use mean for her? How was she introduced to substances? Getting an understanding and actually doing a psychosocial assessment, supporting her being where she's at, because we're doing women a disservice. We're actually actively doing a disservice to mothers and assessing her behaviour as the larger risk and missing what's actually going on behind the scenes. I guess when mothers disclose substance use as well, they're coming to us because they want to share their concerns, they want to share their risk, but then alongside with the stigma, that instigates a statutory response. So it can actually make things worse for the family. And what we do see is women turned away from services because they are using substances. And so when someone's coming to us asking for help, how do we as a service system, irrespective of what our specialisation is, meet that client where they're at and provide tailored support to what they need rather than turning them away because of a moral standpoint or a lack in our own capability. We've held mum up to a different level and a higher standard, and also stigmatised her for using substances and blamed her for something that is not of her doing.
And increased his power.
We really need to think about and look at how we're viewing substance use and how we're viewing mums and women in the context of substance use, thinking through, a harm minimisation lens, but also like really trying to understand, well, what is the substance use about? When is she using those substances? What is the impact of this? What are the substances? Because there are varying, substances that mums might be engaging in, and we need to understand so much about the context and the drivers of that substance use, so that we can really get into working with her around whatever it is that she's needing that support with.
You can do family-focused, child-focused harm reduction work within the alcohol and other drug space. It's not overly complex. So I think it if nothing else, for the kind of practitioners that are starting to engage in this work, it is exploring what does harm reduction mean and what do those conversations look like with victim survivors, which can absolutely navigate substance use coercion as well. We can hold this complexity. It's not beyond us. We can definitely do it. So it's really important for us to upskill, but also to be advocating for the change that we want to see within our sector.
From the research we've seen, any integrated programs that address both family violence and drug and alcohol simply isn't being sustained beyond the pilot phase.
I actually think we're not clear yet about the models that are most effective in this space, because we haven't had the chance to do substantial evaluation in this area. If something only gets to pilot phase, like say Cody, you've only got very small numbers. Like we've had a go, but actually the numbers are too small to really say this is a model that works. And when you looked internationally, there were 9 programs, weren't there, that were peer reviewed, of which by the end of your scoping review, half of them had already finished and weren't sustained. So that I think we're not clear either for victim survivors or for working with the person using violence or for children about what are the best models. Should it be that where you've got working with, men's behaviour change, you need an alcohol and other drug specialist in that space, or should they be jointly facilitated? Should it be secondary consultation? Should it be that you just support the collaboration? There are different models that we could use in this space, but we haven't had the opportunity to really look at the data or to evaluate to say this is the model that potentially works the best. It seems to me that one of the biggest gaps in the whole public health approach, which is looking at primary prevention, secondary prevention and tertiary prevention, so looking at how do you prevent it from starting, how do you support and intervene where you've got children and young people at risk, and how do you respond or do the healing and recovery once it's all happened. The biggest gap is in that secondary prevention. We're not getting in early enough. Like every report you read says we need to intervene earlier. Well, let's intervene earlier, but where have we got the least resources coming? No resources in this saying, actually, let's not wait till we've got to the crisis, which is the tertiary prevention. We know that children who are living with domestic violence and substance use are at risk in all sorts of ways, both right at the moment but into the future, in terms of their health, their well-being and intergenerational abuse.
Like we've had, the Royal Commission into Family Violence and significant reform, I would like to see something similar within the alcohol and other drug space, the substance use space, because with the authorisation of the recommendations, we have been able to see significant change, that this is part of all of our work. That family violence has become part of everybody's work and responsibility. I would love to see that shift within the alcohol and other drug space, because when we think about substance use, we always have the kind of stereotypes. We're missing so much if we just stick to the stereotype and if we're not working in an integrated way. So I'd love to see development in capability within alcohol and other drug space, within substance use coercion, and understanding that, and for the systems and the sectors to work in an integrated manner. I think that is the key. We've spoken about staying in our lanes and what that looks like, and it can be sort of almost a competitive environment. How do we move away from the competition and actually focus on developing a system that is tailored and targeted to what the community need?
That was a short teaser from the Seaboard Conversations podcast.